Hi everyone, I'm Dr. Gauri Apte, and today we're going to conclude our series on perinatal mental health. So, today we're going to talk about self care and some basic interventions to deal with some of the less severe forms of PMAD. For that, we have with us two of our maternal mental health counselors, Varadayini Gorhe and Sanhita Sawant. So let's just get right into it. Vardhani, the postpartum period is often a very vulnerable and overwhelming time for women. So, why do
Right,
you think it is important to focus on self care and on mental health during this time?
right. So after the baby is born, usually what happens is, there's a lot of importance given to the physical side of healing. And the mental health is often looked over, like it's ignored. So even though a lot of changes are physical, like say, there's weight gain due to after the baby's born, or you have sleep deprivation because of the changes in the baby's sleep cycle.
Mhm.
Maybe there'll be some relationship challenges with your spouse or with your in-laws. There are a lot of changes happening, and these definitely affect the mental health of the mother.
Mhm.
And if it's not addressed, definitely it can have longer repercussions,
Right.
say even in the later years. So yes, definitely, there should be importance given to mental health even after the baby is born. Yeah.
Right. Um, yeah, and even though it's such a busy and overwhelming time, I feel like women are often hesitant to actually ask for help. Sangeeta, most new moms will go back to their OBGYN for a follow-up on their physical health, but mental health isn't addressed. So what do you say to that? How should we deal with this?
Yes, it's so very much true. After delivery, a major focus on a baby.
Right.
So there is a mom guilt, to take time for self or asking for help. So basically, self-care is a deliberate choice you make to maintain your own health. Nurturing not only physical, but your psychological, emotional well-being.
Right.
And being a good parent is means knowing when to prioritize yourself,
Right.
get enough sleep, eat well, exercise, having a reliable support network.
Right.
So it's very important to new mom. They start expressing their like psychological emotional symptoms issues, along with the physical one, and get that professional help.
Right. Right. As much as we say prioritize yourself as a new mom, it just, or as a new parent even, it feels like 24 hours are not even enough. So Vardhani, what advice do you have for moms that say there just isn't time for self-care?
Right. So I think, like Sahita said, yes, there's definitely, you need to prioritize mental health at that point wherein, you need to express. Similarly, there's always, there'll be something that needs to be done always. Like,
Right.
especially when the baby's sleeping, people, many of them say, oh, you need to sleep when the baby's sleeping, and so on. But these are, small things that could make a change. It could just be like, having a mug of coffee all by yourself, just taking it easy for a bit when, especially when the baby is napping. So
Yeah.
these things definitely make a difference to how you start seeing, looking at your own mental health as well as a new mom. So even other things, like say taking a shower at, maybe easily, like not
Right.
hurried, or watching some bits of your favorite TV show,
Yeah.
or maybe even, for it may help if you have help, like, maybe if your friend wants to come over, play with the baby, or like, take care of the baby for some time, you
Yeah.
could get some, rest yourself.
Yeah.
So I think all those things do, culminatively make a difference to your mental health too. So
Yeah.
yeah, small things do, that small things are important
Right.
for a new mom to make a change. Yeah.
Yeah, yeah. So I think basically just whatever little time you can take, even if
Yeah.
it's, 10 minutes, 15 minutes, every little thing is going to help. So just do that. And, like you said, the simplest of things might make you
Yeah.
feel better. Even taking a shower in peace is something that's going
Exactly.
to help. So yeah,
Yeah.
I think that's very important. Um, So Sanita, last time we spoke in detail about, postpartum depression, postpartum anxiety. My question is, are there any simple interventions that women can do themselves when they're suffering from maybe slightly milder symptoms of PMAD that may not require immediate medical attention, or something just that can help them deal with those symptoms or cope up with those symptoms?
Yeah, I can say to new moms, they know the best which things sparks joy within them.
Mm-hmm.
So, list down all those things, and you can make a creative self-soothing kit for yourself. As a new mom, there are so many things to focus upon, and sometimes which leads to overwhelming emotions.
Right.
And when the stress takes over mind, then you immediately start experiencing the bodily sensations.
Mm.
And so this self-soothing kit will calm down your will soothe your senses, calm down your mind, and help you to think rationally.
Right.
So in this self-soothing kit, you can keep memories which induce positive emotions, like photographs, letters, uh, then maybe a soothing smell, whichever you like lavender or any other essential oil bottle you can keep. Then tool for expressive writing like a pen, diary, or maybe coloring pages, which is a mindfulness activity which will help you to bring in the present moment.
Right.
Maybe a comfort food or a drink like dark chocolate or your favorite tea or coffee sachet you can keep in that box, as well as a card, a reminder card which will help you to remind you to call your loved ones,
Mm.
or a card with the calming techniques, on which you can write it down, breathing exercises or grounding exercises, or a positive affirmations like
Mm.
um, uh, I must take care of myself so that I can take care of those I love. Or taking time for me is not only okay, it's a necessary.
Right.
Uh, you can keep this box or kit handy so you
Yeah.
can get an access whenever you feel overwhelmed, anxious, or
Yeah.
little bit.
Yeah, that's an excellent idea. I think everyone should, not just new moms. I feel like everyone should have a self-soothing toolkit handy. But yeah, I think all those suggestions make a lot of sense. Thank you so much, Sangeeta and Vardayini, for being here. All of this advice was, I think,
Thanks.
definitely helpful. And to all the new parents, prioritize yourself a little bit, at least take whatever little time you can to focus on self-care, and have your self-soothing toolkit handy so that whenever that panic or anxiety hits, you can have something in your arsenal to deal with it. If you have any other questions, you can leave them in the comment section below. You can also email us at info@fertilihealth.com. Thank you everyone for watching, and stay safe. Thank you both.